Welcome to the Live Long Naturally show, where we explore the secrets to living your healthiest, longest life. From nutrition and fitness to supplements and mindset, we'll help you thrive naturally. Let's get started.
Hello and welcome back to another episode of the Live Long Naturally show. I'm your host, Pavel Rain, and today I'm thrilled to dive into a topic that's not only prevalent, but also incredibly important to our overall health: cholesterol. Specifically, how to lower it naturally without relying on statins. Joining me today is Alira Knox, an expert in holistic health strategies. Welcome, Alira.
Thanks for having me, Pavel. I'm excited to be here and delve into this discussion. High cholesterol is something many people struggle with, but not everyone wants to immediately turn to medication.
Exactly. And I think it's important to underline that while statins are a valid treatment, there are those of us who lean towards natural alternatives, perhaps because of side effects or just a preference for natural methods. What's your take on the importance of starting with lifestyle changes?
It's crucial, Pavel. Lifestyle changes should be the foundation of any approach to improving cholesterol levels. Our diet, activity level, and even stress management can significantly impact our cholesterol numbers. Let's start with diet, as it's one of the most controllable factors. Increasing fiber intake, for instance, can naturally help lower LDL, the so-called bad cholesterol.
Fiber, yes. And when we say fiber, I think it's good to emphasize that we're talking about things like oats, beans, and fruits. What have you observed about the immediate benefits of adding more fiber to one's diet, Alira?
There are tangible benefits pretty quickly. Soluble fiber binds to cholesterol in the digestive system and helps remove it from the body before it can be absorbed into the bloodstream. Many people notice a decrease in LDL levels when they consistently include fiber-rich foods. Even something as simple as starting your day with a bowl of oats can set you on a path to better heart health.
Oats, the breakfast of cholesterol champions. What about incorporating more healthy fats into the diet? I've read a lot about how things like avocados, nuts, and olive oil can be super beneficial.
Absolutely. Healthy fats are not only beneficial but essential. They can help lower LDL cholesterol and raise HDL, which is the good cholesterol. Swapping out saturated fats for unsaturated ones is one way to ensure you're eating the right kinds of fats. I often recommend cooking with olive oil and snacking on nuts or seeds. They're not just heart-friendly, they're also delicious and versatile.
Olive oil is a staple in my kitchen. Now, we can't ignore the importance of movement in all of this. How would you advise listeners to integrate exercise or daily movement into their routines to positively impact cholesterol?
Routine is the key word here, Pavel. Establishing a regular exercise regimen can work wonders for cholesterol levels. Aerobic exercises, such as brisk walking, cycling, or swimming, are particularly effective. They help raise the HDL and can contribute to lowering LDL and triglycerides. It doesn't have to be intense. Even moderate activity for 30 minutes, most days of the week, can make a significant difference.
That's encouraging to hear, especially for those who might feel daunted by the idea of more intense workouts. Switching gears a bit, what role do you believe stress and mindset play in managing cholesterol levels?
A huge role, actually. Chronic stress has been shown to negatively impact cardiovascular health, including cholesterol levels. When stress becomes a chronic issue, people might turn to poor dietary choices or become more sedentary. Incorporating relaxation techniques such as meditation, yoga, or even simple breathing exercises can reduce stress responses in our bodies, lowering cortisol and positively influencing cholesterol regulation.
I find mindfulness and breathing exercises to be great daily practices. It's about finding what works for each individual. Before we wrap up, Alira, let's talk a bit about supplements. Are there specific ones that you recommend for natural cholesterol management?
Certainly, supplements can be a beneficial addition when used appropriately. Omega-3 fatty acids from fish oil can help lower triglycerides, one type of lipid in the blood. Plant sterols and stanols have also been shown to reduce LDL cholesterol. They're often found in fortified foods or as supplements. However, as always, it's important for individuals to consult with their healthcare provider before starting any new supplement regimen.
An essential point: the importance of personalized advice from healthcare professionals. Alira, this discussion has been truly insightful. Thank you for sharing your knowledge and practical tips with our listeners today.
The pleasure was all mine, Pavel. I hope our discussion encourages people to explore natural avenues for their health concerns and inspires some positive changes.
Absolutely. For our listeners, if you're inspired by today's conversation and want to start integrating some of these strategies into your own life, remember it's all about small, consistent steps. Don't forget to subscribe to the Lifelong Naturally show for more insights and strategies to live your healthiest life naturally. Until next time, stay healthy and vibrant.
Thanks for tuning in to the Live Long Naturally show. If you enjoyed today's episode, be sure to like, subscribe, and share it with someone who wants to live a healthier, longer life. Until next time, stay well and live long naturally.